Welcome to the first module of the online course on sarcopenia. Before we continue to the content of this module, let's take a look at the course overview. There are three modules of this online course: Information on Sarcopenia, Introduction, Diagnostic Process, and Treatment Process. Each module consists of a web lecture and a quiz. Bear in mind, this online course is a prerequisite for assessment for and intervention for exercise, class on sarcopenia, which takes place in week 6. Module 1 consists of 5 crucial topics. What is sarcopenia? Epidemiology, causes, symptoms, and subcategories, associating factors, and future of sarcopenia and the costs. After this lecture, you're supposed to understand what sarcopenia is, its causes and symptoms, know the prevalence of sarcopenia, be aware of the associating factors, and understand the future of sarcopenia and your role in it. What is sarcopenia? Word sarcopenia comes from the Greek language and means loss of flesh. It was declared as an official disease in September 2016 when it received a code in the ICD-10 CM. Revised European Consensus on Definition and Diagnosis published in October 2018 established a new definition of sarcopenia and discussed some crucial topics such as characteristics of sarcopenia, algorithm used in diagnosis, and the cutoff points for measurements. According to their definition, sarcopenia is a progressive and generalized skeletal muscle disorder that is associated with increased likelihood of adverse outcomes including falls, fractures, physical disability, and mortality. Sarcopenia is defined as low levels of muscle strength, muscle quality, and physical performance. With aging, protein production and certain hormone levels, such as testosterone and IGF-1, significantly drop, which causes decrease in muscle fiber, both in number and size. This leads to loss of skeletal muscle mass and development of sarcopenia. Epidemiology. Prevalence of sarcopenia ranges from 15% at 65 years to 50% at 80 years. People over 50 lose leg muscle mass 1 to 2% per year and strength 1.5 to 5% per year, which increases the chance of developing sarcopenia. Different factors are known to cause sarcopenia. Based on its cause, sarcopenia can be primary and secondary. In primary sarcopenia, there is only one cause, namely aging, while in secondary sarcopenia, causal factors other than or in addition to aging are present. These could be systematic diseases, especially the ones that may evoke inflammatory processes, for example, malignancy or organ failure. Secondly, physical inactivity due to sedentary lifestyle or to disease-related immobility or disability, and the inadequate intake of energy or protein, which may be due to anorexia, malabsorption, limited access to healthy foods, or limited ability to eat. Based on its duration, sarcopenia can be acute or chronic. When it lasts less than 6 months, it is considered acute. On the other hand, sarcopenia is considered chronic once it lasts 6 months or longer. Acute sarcopenia is often related to an acute illness or injury, while chronic sarcopenia is associated with chronic and progressive conditions. Chronic sarcopenia increases risks of death. Symptoms of sarcopenia are low muscle strength, low muscle quantity or quality, and low physical performance, including falling, feeling weak, weight loss, muscle wasting, having slow walking speed, and difficulties in rising from a chair. Sarcopenia leads to increased risk of falls and fractures, impaired ability to perform activities of daily living, cardiac disease, respiratory disease, and cognitive impairment, mobility disorders, lower quality of life, loss of independence or need for long-term care placement, and death. Associating factors of sarcopenia are age, gender, namely female, low body mass index, smoking, cognitive impairment, polypharmacy or usage of 5 or more drugs, length of bed rest during hospitalization, ADL impairment, and low skeletal muscle mass index. Future of sarcopenia and costs. Sarcopenia increases risk for hospital admission and cost of care during hospitalization. Those with sarcopenia at admission have higher hospital costs than those without sarcopenia. A study from 2016 found that sarcopenia increased hospitalization costs by 34% for patients above 65 years old. Janssen et al. Made a research on the effect of reduced prevalence of sarcopenia on economy of healthcare. The results showed that reduction in the prevalence of sarcopenia by 10% would reduce expenditures for $1.1 billion per year in the United States. Moreover, the percentage of people aged 60 years and over is growing more rapidly than any other age group in the world. However, more research is needed in this field to prevent sarcopenia from becoming a heavy burden for patients and healthcare systems. Finally, physiotherapists need to be aware of sarcopenia and its risks. They need to take actions that will lead to early detection and treatment. This is the end of Module 1. Good job! Your next task is to read the article by Budar et al. 2014. Then, do the application exercises and quiz 1 to test your knowledge. You can find these under this video. Once you complete all these tasks, you can move on to the Module 2.